I'm here in this hospital again. I was here, what was it? Last Wednesday, Thursday, and Friday, and Saturday. And then I'm back again, well, a week before last, and now I'm here since Thursday, Friday, Saturday, Sunday. Today's Monday. And I don't know when I'll be going home because my heart rate is up high. I have this on right now. This is mine. They have it on their machines. Okay, my oxygen is 97 because I got this thing in my nose. But my heart rate is at 105. It's all over the place. Now it's 108. It's just 109. It just keeps jumping up and down. 106. Now, the new thing is, what they want to do is put a pacemaker in, which I'm fighting them on because I don't feel like, well, I'm not a doctor, you know. And I guess that's the standard. I just don't want to be too quick to try to use me as a guinea pig when all I have to do is give me back my medication. I had a lot of fluid built up on my lungs and my heart. I had gotten off prednisone because I have asthma. I blew up. My legs swelled up. Face got fat, round, and just blew up. So it's a lot of fluid. And it made it hard for me to walk from one room to the next. I couldn't hardly breathe. So I came to the ER. So like I said, I stayed here from Wednesday to Saturday. They sent me home with methylprednisolone, which is a more bigger dose than what I used to take. Which is, I was taking 25 twice a day, but they upped it to 50, 100, which is twice a day, 50 in the morning, 50 in the evening. And they didn't give me the Lasix. The Lasix is used to drain the fluid off. It's like a diuretic to drain the fluid off your body. Okay, so they gave me that, but didn't give me nothing to take home. 2 days without it, I finally talked to my primary doctor. She prescribed it for me. But this Thursday, I started blowing up again. My legs started swelling again. And later on that, now I was fine in the day. I thought I was doing good. Later on that evening, I decided I'm going to call the paramedics. Because something ain't right. So they brought me here, and now I'm here. So, like I said, I've been here since Thursday night, Friday, Saturday, Sunday, and today, Monday. I don't know when I'll be going home because now they don't want to let me go because my heart rate is staying up high. And they don't want a lawsuit on them if they let me go and I go out and have a heart attack and die. So now they want to put a pacemaker in, which I'm fighting them on because the doctors that they have on staff to do that, I don't want to deal with. And I would rather have my primary doctor, my pulmonologist, and my heart doctor involved. Not for them just to decide they were supposed to have the surgery tomorrow. I tell them no, it's not happening. Not until I get them involved. So that's where we are now. So don't look like I'm going home right now anytime soon. So I'll keep you updated. Alright, bye. Alright, this is what's happening. The doctor that I wanted to do the procedure, if it had to be done, would be Dr. Rivas. I've never met the man before, but he was actually right next to me, talking to the patient next to me this morning, and I didn't know it was him. So, after he left, I happened to be on the phone with my friend, so after he left, I asked the nurse, who's that doctor? Because I know he's a cardiologist. I know I look crazy as hell. He's a cardiologist, so She couldn't remember his name, so I shouted out. She said, yep, that's it. And I got my phone, put these damn house shoes on, and ran down the hall. Couldn't barely breathe, looking for this man. I found him. And I shouted out, and I told myself, if somebody's going to do it, it's going to be you. Blah, 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 blah. He said, okay. And I name dropped one of his patients. And he said, okay, the hospital that was right by the nurse's station. And they verified that they already tried to reach him, and, you know, the group. So that was that. Anyway, I'm here in the room, stressing. Because they want to do it tomorrow. I wasn't going to have it done anyway. You know, not until I met with all of them. And as we were saying, you know, you got to advocate for yourself. He comes in and tells me. He looks at all my stuff, my records, everything. He does not see anywhere where I need to have one put in. It was like a load just lifted off of me. I was so happy. So yeah, he said, your heart rate is high. We're going to treat it with medication and send you home. I just feel like I got a second chance of life. Because I'm going to tell you, I don't trust these doctors, girl. I don't trust them. They just want to cut on you. It's all about the insurance. Telling you need stuff when you don't need it. You know, This is the third time this has happened to me. Santa Monica, Torrance. No. Anyway, I just thought I'd share that information with you. So hopefully I'll get out of here by tomorrow at least. Alright. Talk to you soon. Bye.